My name is Gelsey Glander. I live northwest of Bruce, South Dakota. One of my favorite things I do is to revive my flowers. I keep them from year after year, and I put them up in the stairs in a room. They come back in the spring. They're just beautiful. I was using Tylenol, and more Tylenol than I was supposed to, and I used topical creams, and nothing did it. The only really relief I had was with the ice pack. I had a cortisone shot in March, and that's when the Dr. Holmoe, he decided, he told me, he said, well, try the cortisone shot, and then we'll see how that goes. And the shot only lasted a month, and then I went into and had physical therapy, and as I kept doing the physical therapy, everything got worse. So in the middle of May, end of May, I told him, I said, I can't take this anymore. We're going to have to do something, because I had pain radiating from my ankle to my hip. And this was the best thing I ever did. Well, this was a suggestion from Dr. Holmoe, and it's amazing how they could separate those tendons and muscles and replace my arthritic hip, and it's amazing. It's wonderful. It's the best thing I've ever done. I doctor in Brookings, and I doctor with Dr. Cruz. I've doctored with her for many years, and it's close to home, and it's a very friendly place. I mean, I never have had such good care. I don't know why anybody would want to travel away. Dr. Holmoe was very considerate. He explained everything that we would do for the surgery, and even after I came back after surgery, he explained more things, because I had more questions, what did we do? And he's very good. He's a very cordial, well-knowledged person. Well, I was admitted at 5:30 on Tuesday, and at 4 o'clock on Thursday, I was discharged. And they said this was because they kept me hydrated. This was the fastest that anybody had ever went out of the hospital. I've never had people treat me so nice as far as professionally, health-wise. They always apologized in the middle of the night when they had to come take your blood pressure or give you a pill. Or it was very clean, cozy. It's nice to have a bathroom close by, a shower. I had physical therapy during the day, and I had to go. First day it was like 3 times around the station, and the next day it was 4 times around the station, and then we did physical therapy in the bed, which I took home the instructions, and I did that at home. And then the 4th day they had put me down for 5 times around the station. Well, by the time they got my shower and a couple times around the station, they said I could go home, so I didn't get to do my 5 times around the station. They said I was doing so well. I had to call Dr. Leadabrand after I got home because my blood pressure had dropped, and she gave me and told me what to do, and she asked me to keep a record of my blood pressure and then bring it back to my doctor when I came for my regular checkup. But as far as Dr. Leadabrand, she's such a kind, soft-hearted person. I guess I did not realize they had hospitalists until I came into the hospital now. I do not have any pain. I mean, the pain radiated from my ankle to my hip. And right now I use a cane when I know I'm going to be walking a lot and when the ground is very uneven. Otherwise, I'm on my own. I never was prescribed pain medication other than Tylenol. And otherwise, I had taken the medication for arthritis, and I do not take that anymore. So, after the success of my surgery, I don't know why anybody wouldn't use the Brookings health system. I mean, you have the doctors and the nurses, the facility that is close to home. So I would just stay with what you like.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.